Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing education on videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. If that is something that you are interested in, please make sure to subscribe now. You hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you'd like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody! Isang panibagong Wednesday morning, Wednesday night, Wednesday afternoon nga, whatever time zone you have. I just wish you a fantastic and glorious day. Smile for today because you deserved it. And yes, another nursing test banking video ang alay ko sa inyo for today. Like I promised, I'm gonna be uploading 3 times a week. MWF nga po tayo nag-upload. So kung hindi ka pa nagsasubscribe, I highly suggest for you to subscribe now so that you don't miss out any episodes, any videos that I am producing for you. Now, I would just like to grab this opportunity before further proceed to thank you who's listening right now for always tuning in and sharing, liking, and really watching the videos. And marami sa inyo nagko-comment that you're learning so much from my content. And nakakataba po ng puso na malaman na nakakatulong po ako sa pag-aaral nyo. Napapadali ko yung buhay nyo. Kahit pa paano may konti kayo natutunan sa akin. Pero that's really the sole intention why I started this channel in the first place. To help my co-nurses, my fellow nurses, nursing students, and nursing professionals alike to refresh and to learn more about nursing field, because as you all know, nursing is quite a big subject matter. It's quite a big type of profession. It's a tough profession. Humihigop ako ng kape, pasensya na, pampagising because I'm shooting this early in the morning. Now, gusto ko lang magpasalamat ulit sa inyo. Maraming salamat po sa lahat ng dedication nyo sa channel ko. We're hitting 20,000 subscribers and I'm hoping that before the end of this year, we will be able to hit that 20,000 mark. Please help me out to share my videos, share the words about my channel para mas marami mga tayo madagdagan at marami tayo matulungan. Now, as we are approaching the end of 2022, gusto ko lang i-announce sa inyo na by late this year or early next year, I'll be launching my very first, my podcast channel. It's all about mental health. It's all about soul. It's all about those conversation about solely about human experience and learning through striving to be the better of yourself, like to reach the highest and truest expression of yourself. That's mainly the intention of it. Now, I haven't thought. I'm still undecided about the title of the podcast, and it's quite a tough choice to make, but one thing's for sure, it's going to be available in all the music streaming platforms that you have, Spotify and all. So I hope you guys can support me there, and I'm definitely gonna let you know when it's going to be published, when it's the very first episode is going to be available for you. All right, so yeah. Now, kung hindi ka pa nagsusubscribe sa channel ko, mag-subscribe ka na, like I said, and follow me in all my other social media accounts. Medyo mahaba nga po itong nursing test banking video, ha. Ngayon, kung hindi mo pa napapanood yung other video uploads na ginawa ko, please make sure to check out the description box because all of the playlist link is there. And follow me on my Facebook page. It's Neil Gave Official for more contents like this. Now, this is an NCLEX practice exam for medical surgical nursing. Nursing 1, sa lahat ng mga NCLEX test takers natin, dyan, hindi lang sa NCLEX, pati na rin sa PNLE, sa mga nagre-ready, this is a sample questions for you na maaari mong reviewin at maaari mo actually ma-encounter sa actual ng day na exam. I got these questions from the previous NCLEX examination. So you might as well be mindful of the rationalization that we're going to be doing for today. Now, nursing test banking, napakarami ko na nga pong video contents na ginawa regarding sa nursing test banking. Check out the description box or whenever the icon button pops out. Anytime of this video, click the one out because I'll be putting the actual playlist link there. Now, without further ado, proceed na natin to. Let me share to you our objectives for today. Now, we only have 2 objectives every time we do nursing test banking video. The first one, I am going to provide and discuss to you board exam, or in this case, NCLEX type of questions. And then I'm going to provide rationalization for each NCLEX type of questions. Now, if there's one thing that I want you to take away out from this video, it is the rationalization, because that is the sole intention why we're doing such videos like this. Let me share to you our instructions for today's examination. You'll be given 10 board exam type or NCLEX type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. You choose the letter of the correct answer. Good luck, nurses. Now take this as if you are sitting on the actual NCLEX exam. What will you do if this is the last 10 questions? This could make or break your the result of the exam. So, do it good. All right? So, hinga-hinga, kalma-kalma, magsisimula na tayo. NCLEX type of question number 1, Mr. Braga was ordered digoxin 0.25 mg OD once a day, which is poor knowledge regarding this drug. Tinatanong ka negative statement. Alin daw dito ang nagpapakita, statement ng pasyente o sitwasyon ng pasyente na nagpapakita na poor ang knowledge ng pasyente ni Mr. Braga sa digoxin. Gets? Let me read to you the choices. It has a positive it has a positive inotropic and negative chronotropic effects. B, the positive inotropic effect will decrease urine output. C, toxicity can occur more easily in the presence of hypokalemia, liver, and renal problems. D, do not give the drug if the apical rate is less than 60. Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter B. The positive inotropic effect will decrease urine output. Bakit? Inotropic effect of drugs on the heart causes increased force of its contraction. This increases cardiac output that improves renal perfusion, resulting in an improved urine output. So, improve nga po ang urine output ng mga pasyenteng nagdadigoxin. In this situation, si Mr. Braga. So, negative question ito, negative answer, maling answer, because ang letter B, it should be increased to make it right. That's why you will choose letter B. Excuse me, I just need to have a sip of my coffee. Nakuha ba yun? Nakuha. Proceed na tayo. And next type of question, number 2. Valsalva maneuver can result in bradycardia. Paano mo masasabing bradycardia if your beats pulse rate is less than what? 60 beats per minute. Which of the following activities will not stimulate Valsalva maneuver? Alin daw sa mga aktibidades na ito, Tagalog na Tagalog, activities na ito will not stimulate your Valsalva maneuver? Alright? Is it A, use of stool softeners? Is it B, enema or enema administration? Is it C, gagging while toothbrushing? Gagging. Is it D, lifting heavy objects? Your 5 seconds starts now. Time is up. What is the answer? Very good. Letter A, use of stool softeners. Why? Straining or bearing down activities can cause vagal stimulation that leads to bradycardia. Use of stool softeners promote easy bowel evacuation and prevent straining or the Valsalva maneuver. Straining, Valsalva maneuver. So, stool softener nga po. use of stool softeners. A is the right answer. Nagets yon? Nagets. NCLEX type of question number 3. The nurse is teaching the patient regarding his permanent artificial pacemaker. Anong sitwasyon? Permanent, may pasyenteng may artificial pacemaker. Which information given by the nurse shows her knowledge deficit about the artificial cardiac pacemaker. Knowledge deficit, ibig sabihin, kulang. Tama? Nasananda ito. Knowledge deficit, meaning kulang sa knowledge. What's this? May lack of knowledge. Right? Okay. Is it A, take the pulse rate once a day in the morning upon awakening? B, may be allowed to use electrical appliances? C, have regular follow-up care? Or D, may engage in contact supports? Your 5 seconds starts now. Time is up. What is your answer? Very good. Letter D, may engage in contact sports. What did I say? Supports? No, let me correct myself. Contact sports. Letter D is the right answer. Why? The client should be advised by the nurse to avoid contact sports. That includes, ano yung mga example ng contact sports? Basketball, football, lahat na may ball. Wrestling, sumo wrestling, lahat na may mga physical requirement. Why? This will prevent trauma to the area of the pacemaker generator. No, ang mga contact sports sa mga pasyenteng may pacemaker. Question number 4. A patient with angina pectoris is being discharged home with nitroglycerin tablets. Discharge ang pasyenteng diagnosed with angina pectoris na naka-nitroglycerin tab. Which of the following instruction does the nurse include in the teaching? Alin daw ang i-include mo na health teaching sa pasyenteng madi-discharge treated with angina pectoris na may take-home medicine na nitroglycerin tablets per orem? Is it A, when your chest pain begins, lie down and place 1 tablet under your tongue. If the pain continues, take another tablet in 5 minutes. B, place 1 tablet under your tongue. If the pain is not relieved in 15 minutes, go to the hospital. C, continue your activity, and if the pain does not go away in 10 minutes, begin taking the nitro tablets 1 every 5 minutes for 15 minutes, then go lie down. Or D, place 1 nitroglycerin tablet under the tongue every 5 minutes for 3 doses. Go to the hospital if the pain is unrelieved. Your 5 seconds starts now. Ang hiningi sa'yo na tanong, proper drug administration, interval, and dosing. Alright, nitroglycerin. Ano to? What's this? Tag dito. Para to sa mga angina pectoris. Alright? Chest pain. Ang tamang sagot dito is letter D. Let me explain to you why. Place 1 nitroglycerin tablet under the tongue every 5 minutes for 3 doses. Go to the hospital if the pain is relieved. That is the right answer. Angina pectoris is caused by myocardial ischemia related to decreased coronary blood supply. Giving nitroglycerin with produce coronary vasodilation that improves the coronary blood flow in 3 to 5 minutes. If the chest pain is unrelieved after 3 tablets, there is possibility of acute coronary occlusion that requires immediate medical attention. Period. Nagets? Nagets. Nangangalahati na tayo. This is our 5th question for the day. Let's proceed. A client with chronic heart failure has been placed on diet restricted to 2,000 milligram of sodium per day. So clearly, meron siyang sodium restriction na 2,000 milligram per day. The client demonstrates adequate knowledge if the behaviors are evident, such as not salting food and avoidance of which food. So meaning, alin daw dito ang magpapakita na nagko-comply ang pasyente sa sodium restriction niya per day? Is it A, na kapag sinabi niya yung food group na ito, alam mo na alam niya na meron siyang sodium restriction per day. Is it A, whole milk, B, canned sardines, C, plain nuts, or D, eggs? Your 5 seconds starts now. Time is up. What is the answer? Very good. The answer is letter B. Hanapin mo yung pagkain o group na mayaman sa sodium. Food na mayaman sa sodium. B is the right answer. Canned sardines. Canned foods are generally rich in sodium content as salt is used as the main preservative. Period. Next question. Pansin mo sa karamihan sa mga tanong na to, karamihan med-surg. Ayun siya. Kaya nga, med-surg type of question. Alright? Now, number 6. A student nurse is assigned to a client who has a diagnosis of thrombophlebitis. Which action by this team member is most appropriate? Ano ang diagnosis ng pasyente mo? Thrombophlebitis. Ay, saan yung cursor ko? Ang hinihingi sa'yo ng tanong, anong action by the team member is most appropriate nursing action sa pasyenteng may thrombophlebitis? Is it A, apply a heating pad to the involved site? B, elevate the client's legs 90 degrees? C, instruct the client about the need for bed rests? Bed rest ba? Malamang sa alamang, chari. Or D, provide active range of motion exercises to both legs at least twice every shift. Your 5 seconds starts now. Time is up. I kind of like give away the answer to this one, but the answer is letter C. Instruct the client about the need for bed rest. Bakit mo kailangan i-bed rest ang pasyenteng may thrombophlebitis? Here's the reason why. In a client with thrombophlebitis, bed rest will prevent the dislodgement of the clot in the extremity, which can lead to pulmonary embolism, PE. May make sense? Ayaw mo na siyang gumalaw ng gumalaw. Kasi baka mamaya magkaroon ng pulmonary, mag-PE yan, mag-travel yung embolus papunta sa blood clot, papunta sa heart. Nako, mas malaking problema. Bed rest nga po ang tamang sagot. Next, question number 7. A client receiving heparin sodium asks the nurse how the drug works. Ano yung drug? Heparin sodium. Tinatanong ka, anong action daw ng heparin? Which of the following points would the nurse include in the explanation to the client? Action ng heparin, that is the question. Pharma. A, it dissolves existing thrombi. B, it prevents conversion of factors that are needed in the formation of clots. C, it inactivates thrombin that forms the dissolves existing thrombi. D, it interferes with vitamin K absorption. Your 5 seconds starts now. Time is up. What is the answer? Very good. Letter B. It prevents conversion of factors that are needed in the formation of clots. Yes. Heparin is an anticoagulant, as we all know. It prevents the conversion of prothrombin to thrombin. It does not dissolve a clot, period. Conversion of PT to thrombin. Prothrombin to thrombin. Prevention inhibits. Alright? Alright. Next question, number 8. The nurse is conducting an education session for a group of smokers in a stop smoking class. Which finding would the nurse state as a common symptom of lung cancer? Ano daw ang common symptom ng lung cancer? That is the question. Muna pahirapan ang sarili mo. Let me read to you the choices. Is it A, dyspnea on exertion? B, foamy, bloody tinge sputum. Nako. C, wheezing sound on inspiration. D, cough or change in chronic cough or in a chronic cough. Your 5 seconds starts now. Medyo tricky ito kasi you might want to choose the worst answer. Or worst answer among the choices. The answer is letter D actually. Very simple. Let me explain to you why. Cigarette smoke is a carcinogen that irritates and damages the respiratory epithelium. The irritation causes the cough, which initially may be dry, persistent, and unproductive. As the tumor enlarges, obstruction of the airways occurs, and the cough may become productive due to infection. The answer is D. Malinaw? Malinaw. Board exam type of question number 9 or NCLEX type of question number 9. Which is the most relevant knowledge about oxygen administration to client with COPD? Madalas itong sitwasyon sa ward. Med-surg ward. Nagkakagulo ang mga nurses kapag may target auto-saturation ang pasyente. COPD. May ibang nurses hindi aware about sa concept ng oxygen administration sa mga pasyenteng may asthma, COPD, emphysema, COPD cases. This question talks about that. Alright? What is the most relevant knowledge about oxygen administration to client with COPD? Mahalaga ito ha, makinig kayo. Is it A, oxygen at 1 to 2 liters per minute is given to maintain the hypoxic stimulus for breathing? Is it B, hypoxia stimulates the central chemoreceptors in the medulla that makes the client breathe? C, oxygen is administered best using a non-rebreathing mask? Or D, blood gases are monitored using a pulse oximeter. Sasapukin kita, magigigil ako sa'yo. Your 5 seconds starts now. Time is up, nurses. What is your answer? Very good. Makinig ha. Letter A. Oxygen at 1 to 2 liters per minute is given to maintain hypoxic stimulus for breathing. Listen, COPD causes a chronic CO2 retention that renders the medulla insensitive to the CO2 stimulation for breathing. What is the gas that stimulates our respiration? It is carbon dioxide. It's never oxygen. Gets? The hypoxic state of the client then becomes the stimulus for breathing. Giving the client to oxygen in low concentrations will maintain the client's hypoxic drive. Ayaw mo magkaroon ng CO2 retention ng pasyente mo may COPD. That is the point. Kaya normally, nag-order ang doktor ng auto-saturation, place the client on nasal cannula or face mask. Depende sa requirement. Face mask sa mga COPD patient ha. Face the client on nasal cannula as long as auto-saturation is more than 94%. So walang rate na binibigay basta ang auto target mo nahihit mo yung 94% auto saturation. It could be 4, it could be 5. Tapos tinatry nating i-win off sila as they go, ayaw nating mag-stick sila sa oxygen. Oxygen dependent ang mga COPD cases natin. Alright? Last question na nga. Kung hindi ka pa nagsasubscribe sa channel ko, mag-subscribe ka na. And please make sure to share this video to all of your friends out there para naman mas marami ang makaalam. Maraming salamat po if you get this far of this video. Get to like this way far of this video. Way far. The end of this video. Maraming salamat po. I appreciate. Also, don't forget to put your scores on the description box ha? Or sa comment section para malaman ko. May evaluate ko yung scores ng mga students ko. Let me read to you the last question for today. Question number 10. When suctioning mucus from a client's lungs, which nursing action would be least appropriate? Concept ng suctioning, alin daw dito ang least appropriate? Least. Wrong. Is it A, lubricate the catheter tip with sterile saline or saline before insertion? B, use sterile technique with a two-gloved approach. C, suction until the client indicates to stop or no longer than 20 seconds. D, hyperoxygenate the client before and after suctioning, which is kadalasang nakakalimutan natin. 5 seconds starts now. time is up, you guys. What is the answer? Let me read to you the question. The answer. Letter C. Suction until the client indicates to stop or no longer than 20 seconds. One hazard encountered when suctioning a client is the development of what? Hypoxia. Hence, you hyperoxygenate and post-oxygenate the patient. Pre and post oxygenation po. Suctioning sucks not only the secretion but also the gases found in the airways. This can be prevented by suctioning the client for an average time of 5 to 10 seconds and not more than 15 seconds. The hyperoxygenating or oxygenation of the client before and after suctioning will also prevent hypoxia of the tissue. Alright. Malinaw ba yun? Malinaw. Thank you so much, you guys, for watching. I hope you learned something today. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Also, don't forget to put your scores on the comment section below. Huwag mahihiya. Pinaghirapan mo yan. Like I said, this is a practice. It's free. It's okay to make mistakes. Now, okay, do it. Pinaghirapan mo yan. Let me know what's your score on the comment section below. Tulungan nyo na nga ako. Ipamalitan nyo na sa Radyong Sira. Pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. And I'll see you again on Friday for another nursing discussion. Don't forget to follow me, on all my other social media accounts. Everything is at Neil Gave, except for my TikTok account, which is Neil Gave Official. And also don't forget to follow, like, and share my Facebook page. It's Neil Gave. All the links is on the description box. I'll see you again on Friday. You have a good one.